What's up, guys? How's it going? Cade More for Muscle, and today we're actually going to be talking about something pretty interesting. I enjoyed learning about, and that's eating disorders. So this is a mental health issue, and eating disorders can cause risk for suicide. So we'll first go over anorexia nervosa. That's basically when there's a persistent energy intake restriction. So you're restricting your food intake. You're not getting enough nutrients for a fear of getting fat, and they usually have a self-perceived weight or shape, and they think that they're overweight. Um, and there's bulimia nervosa is another eating disorder, and this is basically eating reoccurrently eating large quantities of food over a short period of time, and then doing compensatory behaviors such as self-inducing vomiting and exercising extreme and doing things such like that. So there's the anorexia nervosa, where that's like a constant lack of energy and restriction, constant restriction of food. And then bulimia nervosa is where they eat like a ton of foods, and they'll use um, coping mechanisms like exercise, like extreme exercise, throwing up, uh, and stuff like that will help. So risk factors: being a picky eater, participation in athletics, where like a lean body build is necessary, a history of obesity. Fashion modeling can actually be one of the risk factors because you want to look really thin. Um, there's family genetics, then there's also biological, where you have a neurotransmitter problem, and you just think like eating too much is bad. Um, and then obviously relationships, environmental factors, and like a person's temperament. But this is what kind of got interesting for me, is like the mental status. So I think a lot of us actually use these, and including I've actually seen myself use these, but there's over generalizations, like other people don't like me because I'm fat, or all or nothing thinking. So if I eat this dessert, I will gain 50 pounds. Or catastrophizing. My life is over if I gain weight. Personalization. When I walk through the hospital hallway, I know everyone is looking at me. Emotional reasoning. I know I look bad because I feel bloated. So yeah, guys, these mental status, these thoughts that we have, these all or nothing thoughts, these overgeneralizations, these personalization, emotional reasoning, all these thoughts can be very harmful and cause these eating disorders. Um, so guys, we want to make sure that if we do have these thoughts, we can't do the all or nothing thoughts, like, if you eat dairy, oh, this is terrible for you, or, if you eat vegetables or whatever, if you eat cake, it's going to be cause you tons of harm when it really won't. So the next thing is, guys, if you do see something, you do see a person with like an eating disorder, you'll expect to see their low blood pressure. Guys, the reason is food is actually a stimulant. So when you don't have food, your body's gonna slow down. Your blood pressure is gonna go down, and your body temperature is gonna go down, because food is like fuel, and your body needs to burn that food, and when you burn food, your temperature goes up, and then hypertension can actually be caused from people that have binge eating disorder, which is when you eat a ton of food. But if you see someone that's constantly restricting food, that you'll see low blood pressure and a low body temperature. So most clients that have anorexia nervosa, they'll have like 85% of an expected normal weight, so they're gonna be underweight. You'll see that they have skin, their skin, hair, and nails. You'll see like lanugo on the face, which is like a type of hair. Yellow skin, pale cool extremities, and like clients who have do self-induced vomiting can cause calluses or scars on hand, neck, mouth, and throat. You can have like dental erosions. So in nursing school, they tested us a lot on the dental erosions because when they throw up, that the acidity in the teeth isn't good for you consistently. And same thing is when they make themselves throw up. That's why they'll have calluses on or scars on their hands. So you'll see cardiovascular system, irregular heartbeat. A big thing is the reason why they have irregular heart rate, or like peripheral edema or acronocyanosis, is because electrolytes actually are really important with the heart. Potassium particularly plays a big role in the heart function. So when you're not getting food, your body's not going to have those electrolytes, and you'll get, cardiac dysrhythmias or whatnot. The next thing is fluid electrolyte imbalances. You're going to have acidosis or alkalosis. Your pH is supposed to be about 7.35 to 7.45. Too low would be acidosis, or too high would be alkalosis. And guys, that's your body got to be, pretty specific in that pH range. Anything too high or too low can be really detrimental to your health. Muscle weakness, decreased energy, loss of bone density, constipation, diarrhea, abdominal pain. Some, people that have bulimia, bulimia nervosa. Some people that have that, they take excessive diuretics or laxatives because that just, gets everything out really quick. And this can affect your reproductive status, your psychosocial, decrease your mood. There's medications, fluoxetine. This can help. Then there's also something called refeeding syndrome. And refeeding syndrome is the potentially fatal complication that occurs when fluids, electrolytes, and carbohydrates are introduced to a severely malnourished client. So a person that hasn't had any food for days, and they suddenly get a ton of food, their body's not going to know how to handle that food. So this can cause hospitalization, and you want to control the rate of nutrition these patients are receiving. And you want to monitor blood electrolytes and administer fluid replacement as prescribed. This can also the refeeding syndrome can cause cardiac dysrhythmias, severe bradycardia, which is like slow heart rate, and hypotension, which is low blood pressure. So you want to monitor their heart, monitor their vital signs, and you want to report any changes in client status. So anyways, guys, I hope you guys learned something. This is nursing for eating disorders. I thought this was particularly interesting, and I thought that the thinking, like the all or nothing thinking or the emotional thinking, can actually be pretty detrimental, especially when you see all these things on YouTube, on social media, of these people that do extreme diets. And so you kind of get listening to them, and then you expect, oh, that's, if you eat this certain food, you should feel bad. And so social media and those type of things, and that, bad thinking can really affect your mental health with eating disorders. So anyways, guys, thanks for watching. Subscribe, please.